Hello. Hi, I'm Dr. Tracy Paschke with Heart Health Prevention and Wellness. And thanks for joining me tonight. We're going to do some live Q&A. And if anyone has any questions, you can go ahead and put them in the chat and I'll try to answer them. Let me know if you can hear me and see me okay. All right, great. Okay, so I'm a preventive cardiologist and I've been in practice for over 25 years. And my company is Heart Health Prevention and Wellness, and I help educate people on how to prevent heart disease. So I spent the first 25 years of my career taking care of people after they had heart attacks or heart failure or abnormal heart rhythms. And now I focus on helping people to help keep them from having those issues in the first place. So preventing heart disease, preventing heart attacks and congestive heart failure and arrhythmias. So that's my focus these days. So, I thought we'd use this time if you had any questions about heart disease. We're winding up, it's Heart Month in the U.S. anyway, and we're winding up Heart Month ends in February. So if you have any questions about any specific questions about the heart or specific questions about prevention of heart disease, I can help you with those. Of course, I can't give medical advice, right, because I'm not your doctor, but we can talk in generalities, so you might find it helpful. So I wanted to just kind of talk about some things before people post questions. When we talk about preventing heart disease, we always focus on the risk factors for heart disease. So risk factors for cardiovascular disease are things like high blood pressure and high cholesterol, smoking, family history, so genetics play a role. Then things like, diabetes is a risk factor for heart disease. But if you think about it, so take a step back from that even, how do we prevent those things? So obviously we can't change our genetics, but it's estimated that only about 20% of heart disease is related to genetics. So that means that the other 70 to 80% is under our control, right? So we can do things that help modify those risks. So how do we keep from getting high blood pressure and high cholesterol and diabetes? Well, that's the things like good healthy diet, exercise, restorative sleep, so good healthy sleep, social connection, stress management, and avoiding risky substances, so like alcohol and tobacco. So, if we focus on those things that help us modify our risk factors, so not even to get those risk factors in the first place, right? So if we follow a healthy lifestyle, then we may never get high blood pressure, we may never get diabetes or high cholesterol, and then that lowers our risk of cardiovascular disease, certainly, and also other things like it keeps our brain healthier and decreased risk of some types of cancers. So all these things that are good for the heart, these lifestyle changes that are good for the heart, are also good for other diseases as well, prevent other diseases. So in my practice, I focus on the pillars of lifestyle medicine. So lifestyle medicine is a whole specialty in and of itself, where we learn, different aspects of prevention based on data. So, they study what's good for us and what helps us prevent different diseases. And we use that to help guide people in what to do. So the pillars of lifestyle medicine, number one is healthy diet. So focus more on what we call a whole food plant-based diet. So that's eating things like fruits and vegetables and legumes, peas and lentils and beans and some less processed foods, less animals or animal products, right? So, nutrition, diet is very important, and often we don't really think about what we're eating. Is it good for us? Is it healthy? We just eat because whatever's convenient, or we drive through and it's quick and easy, and we grew up eating the same things. We learn to eat through our family often, and we eat what they ate, and so often we don't even think about it. So that's kind of the first step, right, is being more mindful about what you're eating or drinking even. Paying attention to what you're putting in your body, and is it good for you, right? So that's kind of the first step, being more mindful of what you're putting in your body. And then, once you start thinking about it more, you kind of look at it in a different way. Well, is this thing, is this Big Mac, is that going to help my body or hurt it, right? So Big Macs aren't good for you, so it's probably not the best choice. So you can use that sort of thought process, and it might help you think about the way you're eating and a way that you could do some things differently that would be healthier for your body, right? And so focus, the World Health Organization has categorized processed meat, so like bacon, sausage, hot dogs, deli meat, and group them as a group 1 carcinogen. So same group as tobacco and asbestos, right? So that's how unhealthy those foods are, and we don't really think about that. A lot of people eat a deli sandwich every day for lunch. So just becoming more knowledgeable about diet and what's good for us. There are a lot of great resources that I recommend to my patients for nutrition facts. My website, I try to write about nutrition and post lots of helpful resources on there. My website is www.hearthealth.care. So you can find information there. Some of my other favorite resources are nutritionfacts.org. That's Dr. Greger, and he's a great resource. There is Forks Over Knives. That's a great resource. They have a documentary and a magazine that comes out every few months full of great plant-based recipes. And then another great resource is Physician Committee for Responsible Medicine. So that's a plant-based physician group. So those are all good resources. The best diets for your heart, the best one is whole food plant-based diet. If you can't quite do that, cutting out meat is health. Even if you can't go all the way plant-based, less meat is better. So I tell people, I try to meet people where they are, right? If they don't think they can cut out meat altogether, less is better than more, right? So, and I tell people to, start slow, right? So maybe start with a meatless Monday. take something that you cook. So say your tacos, instead of putting ground beef or chicken in your tacos, maybe you make those tacos with brown rice and black beans, and then put your toppings on. There are some great plant-based cheeses now. There's plant-based milk. So there are a lot of substitution, dairy-free ice cream. So you can make a lot of substitutions these days. And if you haven't eaten plant-based, you may not even know all the stuff that they have. So that's worth checking out. But I tell people to start slow. Start with your Meatless Monday. Maybe then that lets you experiment with different recipes, different ways of eating. You might find you feel better if you eat less meat and less processed foods. It might be beneficial for you in that way. So then I'm going to try to set this up here. So then the other tips I tell people, there are some good subscription boxes, plant-based. The one I use often is Purple Carrot, so that's completely plant-based. That exposes you to some different recipes and some different ingredients that you may not have tried in the past. I know HelloFresh has you can choose vegan options there. So there are some different ways to try different recipes and experiment with different things to check out. So a whole food plant-based diet, that's the first pillar of lifestyle medicine. Then number 2 would be move more. So again, this is, meeting people where they're at, right? So some people hate to go to the gym and they're never going to go to the gym. So that's not a good option for them. But maybe you like to go for a walk outside when it's nice, or you walk your dog, or maybe you have a garden and that's your exercise, or you clean the house several times a week just to get some exercise, some movement. Think of ways to move that are fun for you, that you enjoy. So it doesn't become such a, as much of a chore, but something you enjoy more. People in the blue zones, you may have heard of the blue zones. That's places in the world where people live the longest, healthiest lives. Often they don't have a regimented exercise program, but they move more in their daily life. So they garden, they walk to the grocery store, they walk instead of drive. So again, anything that you can do to move more. Exercise is great for not only your heart, but it's great for your brain. Exercise is one of the best ways to protect our brain as we age. So it's good for you in a lot of respects. The third pillar of lifestyle medicine is restorative sleep. So we're learning, it seems like every week another study comes out about how important sleep is. Sleep is when our brain washes the toxins from the day's thinking out of our brain and sort of cleanses the brain. So that's the deep stages of sleep. So it's important that we get deep, restful sleep. The average American, the recommendation is that we get 7 to 9 hours of sleep every night, and the average American does not get that much sleep. So this is something that we really need to shine a light on and focus on, because sleep's good for our brain, it's good for our mental health, and of course, there's a connection between poor sleep and weight gain. So it's harder for people to lose weight. It has to do with different hormones in the body. So if you're not sleeping well, It makes it harder to lose weight. And then there are the sleep associated things like sleep apnea, right? Where you occlude your airway during sleep and it causes your oxygen level to fall. And then that has consequences like, can make your blood pressure go up, make your blood pressure more difficult to control, can make you have abnormal heart rhythms. It's been linked to congestive heart failure, stroke, and sudden death. So, certainly there are issues like that as well. So I tell people when they're trying to figure out how to sleep better, I talk to people about what we call good sleep hygiene. So, getting ready for sleep and sort of training our body to sleep better. So I tell people to kind of work backwards. So let's say you want to get up at 6 a.m. To get ready for work. And so that means if you're going to get your 7 to 9 hours of sleep, then you need to go to bed about, if you want to get up at 6, you need to be asleep by 10, right? So if you're asleep by 10, that means, you're not just going to fall in the bed and be asleep, right? So you have to have a sort of winding down time, right? So, and I tell people, think of it like when you're sleep training your children, right? You don't just throw them in the crib and then expect them to go to sleep. You have a routine, right? You give them a bath and you cuddle with them and you read them a story, and then that makes them sleepy, and then they're able to go to sleep better. Well, it's the same thing with adults. We don't always think about that or do it, but so this winding down time. So if we want to be asleep at 10, then around 9, so, an hour before then, you start your winding down routine. So, you start, you turn off the screens, right? Because we get blue light from our screens that interferes with our brain and makes it more difficult to get restful sleep. You start, you dim the lights. You're not gonna, if you're reading a book, right, you're not going to read some drama, but a nice, relaxing book. You might take a warm shower or sit in the hot tub or drink some herbal tea. You don't want any heavy meals, no alcohol. That disrupts your sleep patterns. Some people say, well, it helps me fall asleep. Well, it may help you fall asleep, but you don't get good restful sleep. So it interferes with the deeper stages of sleep. So you want to avoid alcohol. So all those things kind of prepare your brain to get ready to go to sleep. You brush your teeth, you wash your face. So all these things, this is your nighttime routine. And then when you get in bed, you have a nice comfortable bed. Your room is dark, blackout shades or whatever you need to make your space dark. And maybe a sound machine if that helps you, or a fan, some sort of white noise. And it's cool in your bedroom, so you sleep better when your temperature's down around like 66 to 68. So it's cool, it's dark, it's calm, and it's a restful place, right? So it makes it easier to sleep. So all those things help prepare you for sleep, and they help you fall asleep. And if you do that, you'll find that your sleep is good, and it's important for your overall health. So don't forget about sleep. So then the next pillar of lifestyle medicine is stress management. So, this is a big one, right? We're under a lot of stress. We have work and family and even things outside our sphere, right? So, humans, through evolution, humans lived in small groups, right? Up 30 to 50, and that was our group, and that's who we lived with. They were related to probably most of those people, but we lived in these small bands of of people. Well, now, in modern society, we're around a lot of people all day. We can turn on the TV or our phone and see problems happening across the world, and it's this constant barrage of stress and worry, and it's just a problem with our modern life, right? So we have to learn how to filter some of that out, to set boundaries. Maybe you set a timer on your phone, and you only are on social media for an hour a day, or whatever you set your time at. And when your alarm goes off, you turn it off and you're done for the day. So putting in these systems to help keep us on a more even keel, right? Where we're not bombarded by these stressful things all day. Evolutionarily, these stressors were helpful, right? That's what kept us alive. So when we were in the forest and the tiger was jumping out at us, we had to have a stress response in our body. Our stress hormones, you've heard of fight or flight, our stress hormones surge, and we're ready to run from the tiger or fight it off, right? And it was helpful. It was how we stayed alive. Well, back in the day, right, but we don't need that these days. So we have that stress response when something, maybe when you're driving and a car pulls out in front of you and you get that sudden surge of stress hormones. Again, that's keeping you alive. But what we have these days is this sort of chronic elevation of these stress hormones from all the stress we're exposed to in our daily life. And those elevated stress hormones cause problems for our health over time. They cause inflammation in the body to increase, and this chronic state of inflammation underlies a lot of illnesses. It underlies heart disease, some autoimmune disease, some brain diseases. So again, we need to practice habits that help support this stress management. So that's things like journaling, meditation, prayer, listening to music, anything that's yoga, tai chi, qigong, tapping, EFT tapping is good for stress release. So, there are a ton of things. We can find resources online to teach us some of these things. So try to work this stress management into your life, because it's one of those things, if we don't consciously make an effort to work on that part of it, then sometimes we don't think about it, and you go through your day and you haven't done anything for self-care, right? To take care of yourself. You've been taking care of people at work, or taking care of your family or your kids, and now it's 9:00 and you're tired, and you haven't done anything for your own stress management. So really keep it top of mind, and you can, I tell people, even schedule it into your day. So just like you schedule in your meetings or your appointments, you schedule in your self-care. So 30 minutes in the morning, maybe you get up before everybody else so you can meditate, or at the end of the day when you're winding down, maybe that's your journaling time. So that helps sort of process all the stuff you've been going throughout the day, dealing with, and so that's part of your stress management. So just kind of think about ways you can work this into your, and try to do something every day for yourself. So the next pillar is social connection, and that means just what it sounds like. So we know that humans are social beings, right? So part of our in our brain, again, evolutionarily, we had to help each other out, right? We lived in these small groups of people, and maybe one person was a better hunter and one person could find the best berries, and so we pooled our resources, and that's how the band survived, right? Well, so in modern society, we've, often we don't live near our family anymore. People are on their own. People are isolated. A lot of people work from home. And so this social connection part, you really have to make an effort to put that into your life sometimes. So what there are meetup groups, and you can join clubs where like-minded people are doing things that interest you. We know that regarding heart disease, we know that people who've had heart surgery or heart attack, some sort of cardiac event, afterwards, if they're lonely, they don't do as well. So it has real impacts on survival. So we want to make sure that we're fostering those social connections. And again, it's something we have to work at sometimes, right? Because we're tired, we're worn out, we're stressed out from the day. We may want to come home and lay on the couch and scroll social media, right? So we have to really make an effort and try to reach out to people. The old saying is try to connect with one person every day, right? So reach out to someone every day. Again, it just fosters that social connection. It's good for our mental and our physical health. And then the last pillar of lifestyle medicine is avoiding risky substances. So I hope everybody knows by now that smoking cigarettes is bad for you. Vaping is not good for you either. Sometimes people use vaping as a bridge to stop smoking, which I think is sometimes that's helpful for people, but I don't want people to think that, oh, well, I can vape because that's safe. It's not. So, make your quit day for vaping just like you do for cigarettes. Alcohol, there are some conflicting things about alcohol. Remember, we used to hear that a glass of red wine was good for your heart, so everybody needed to drink red wine every night for your heart. The problem with that, when a doctor tells someone that it's okay to drink some wine every night for your heart, people, it goes from a little bit of wine to a couple of glasses of wine to a bottle of wine, right? So it's something that can get out of hand before you know it. And, they revisited that data on alcohol in the heart. They looked at that data again last year, and there were some questions about the validity of some of those findings. And don't forget, so if you just focus on the heart, don't forget the other things, right? So alcohol affects your brain. I mean, it's one of the worst things for brain health. And as we get older, fall risk is something that we are thinking about. So alcohol impairs your balance and certainly your judgment sometimes. So I tell people to cut back and consider even cutting out alcohol. As far as, the latest thing is marijuana, right? So marijuana is legal in a lot of places now, so a lot of people are using marijuana. The data coming out on smoking marijuana increases cardiac risk, so increases risk of abnormal heart rhythms, of even heart attack was the latest paper that came out a couple months ago that was very concerning. So again, I tell my patients to try to avoid smoking marijuana. Again, I would just think of it sort of in the broader context, back to the mindfulness part about eating is the same thing. So whatever I'm doing, is it good for my body? Is it good for my health? And maybe, you're like, well, I'll just do it today. But it's also about our long-term health, right? So we want to age in good health. We may want to live to be 100, but we don't want to live to be 100 laying in the bed in the nursing home. We want to be an active 100, right? That's my goal. I want to live to be 100 at least. And I want to be able to run around with grandkids and great grandkids. And I want to be sharp in my mind, and I want to be constantly learning and evolving throughout my life. Well, if I don't pay attention to my health now, then I won't get to live to be 100 in good health. So these things, I try to tell people, because sometimes people can get depressed, right? About, oh, I have to do all these things. I'm not going to have any fun. I can't eat this anymore, and I can't drink, and I can't lay on the couch. But I wouldn't look at it like that. I would look at it a different way. I would look at it like we have a lot of power to affect our health, right? So we can make good choices and have good outcomes for our health. Now, obviously, some people do all the right things and they still have heart attacks or they still get cancer. Sure, that happens. But I can tell you, if you've been living a healthy lifestyle and you have a heart attack, your chances of recovering from that heart attack are greater. We know people that have a cardiovascular event and they continue to smoke, or they don't exercise, or they continue to follow an unhealthy diet. They don't do as well. They need repeat procedures. They're at risk for second events, so second heart attacks, second bypass surgeries. So, all the things. You don't want to go through that again, right? So all these things, it's empowering to know that we can take control of our health, and we have a lot of power over it. Again, for cardiovascular disease, it's estimated that it's 20% genetics and 80% lifestyle. So that's great, right? Because that lifestyle piece, that's the piece that we do have power over. So that's what I try to tell people, that it shouldn't be depressing and upsetting. It should be empowering, that we can make these better decisions and have a greater impact on our health. So those are the pillars of lifestyle medicine. So I think, it kind of goes back to, it was like the way of in the past, right? Even like Hippocrates talked about that prevention was better than treatment, and food was medicine, right? So even the old Greek scholars thousands of years ago knew this. I think in our healthcare system we got away from that, right? Because our healthcare system is, it's gotten kind of weird, right? So it's a 15-minute visit with your doctor, and they give you a pill, and they don't have time to talk to you about all these lifestyle things, and often the patient doesn't want to hear those things because it's easier to take a pill, right? It's easier for you to take a cholesterol pill than it is to follow a plant-based diet. Now, it may not be better in the long run, right? Because you're taking a medication that has its own set of issues and can have potential side effects. So any of this stuff, if we can control our blood pressure with diet, and we can not get diabetes by following a healthy diet and exercising, again, that's the best solution, right? So it does take a little bit of reframing things, right? So reminding people that we have a lot of influence over our own health. And again, we know that, I think, but we've just gotten away from that. So I'm trying to help people realize that and kind of steer people back to it, because I think that's the solution, right? Because the statistics are bad, right? Healthcare, there are more chronically ill people in the world, but in the United States, than ever before, right? The majority of us are obese. The majority don't exercise. The majority of Americans follow what we call the SAD diet, the standard American diet. So it's full of meat and processed foods and very little fruits and vegetables, little fiber, and all this is affecting our overall health. So again, not just your heart, right? I'm a cardiologist and I take care of the heart, but the body, everything works together. So what we do that's good for our heart is also good for our brain, and it helps us prevent certain cancers, and it helps us feel better. So it's all related. If anyone has any questions, you can just type them in the chat. I think I can see them. I hope. The other diets that have been shown to be good for your heart, so there are a few, right? So a whole food plant-based diet, certainly. The other diets that are good for your heart are a Mediterranean diet. So that's a diet that's high in fruits and vegetables. They have some, mainly fish, so some meat, but smaller portions, right? Not a big piece of meat that's half the size of your plate, but a smaller portion of meat, and it's mostly fish. And then olive oil and some nuts and seeds. So that's the basis of a Mediterranean diet, and that one's been studied, and that's good for your heart. The other one that's good for your heart is a DASH diet. So that one's been shown to lower blood pressure. Again, it's based in plants, mostly fruits and vegetables, low sodium. So watch your sodium intake. Some people are very, eating more sodium affects their blood pressure more than others. So something just to think about if you're having trouble controlling your blood pressure. Check the sodium content in your food. American Heart Association recommends 2,000 milligrams or less, but lower is better on that. Cheese is very high in sodium. That's something that people don't think about often. So if you eat a lot of cheese, that can increase your sodium, which can elevate your blood pressure. So those are the best diets for your heart. And again, the standard American diet, so what most people eat is things like a lot of meat and potatoes and no vegetables or not many vegetables, and a lot of white foods, right? So those are processed, anything that's white. So white rice, white pasta, white bread, those are processed, right? So they take the brown rice and they process it and it comes out white. And it tastes a little better for most people. So that's what most people eat is white rice. But brown rice is better for you. So avoid white foods. The other part to remember is that when people eat a lot of meat, they're not getting fiber. So there's no fiber in animals or animal products. There's no fiber in beef, chicken, fish, eggs. There's no fiber in that. So fiber is very important, right? It helps move things through our colon and sort of cleanses the gut. you may have heard that they've lowered the guideline for colorectal screening. It used to be we started screening people for colorectal cancer at 50. Well, now they've had to lower the age to 45 because so many young people are getting colorectal cancer. And a lot of people think it's related to our diet, that standard American diet that's a lot of meat, a lot of processed foods, and low in fiber. We know that fiber decreases breast cancer in women. Fiber is good for the gut. So really focus on eating more fiber. I recommend my patients download an app called the Daily Dozen. So that's Dr. Michael Greger, who runs nutritionfacts.org. Again, he's a great resource. He has this app, and every day you try to eat these 12 things on the app, and it has a little check box, and you can check the boxes as you go through your day. He recommends adding a tablespoon of flaxseed and a teaspoon of cinnamon every day to your diet. So you can, with your oatmeal in the morning, you can put that in your oatmeal. You can sprinkle it on flaxseed on your salad for lunch. Flaxseed and cinnamon are antioxidants, anti-inflammatory, and they're good for us. So that's on his list of Daily Dozen. I think there's like 3 servings of beans. Beans are great for health. Some of the people in the blue zones that I talked about earlier, one of the things all those places have in common is that they eat a lot of beans in their diet. So beans are great. So it's, leafy greens are excellent. So that's like kale, lettuce, although not like iceberg lettuce. That's deplete of nutrients, but other lettuce, things like, beet greens or chard. Kale's a great one. You can take the kale, you get your kale and you wash it and you strip the kale off the stalk and put it into, bite-sized pieces and throw it in your air fryer. And if you want, you can spritz a little olive oil on it, or even air fry it dry, but and a little salt and pepper, and you put it in your air fryer at 300 degrees for 5 or 6 minutes, depending on how toasty you like it. And it's great. It makes great kale chips, and you can eat that every day. So that app is great, the Daily Dozen. So it helps you keep track of all the healthy things and if you eat everything on that, all 12 of those things every day, you'll be full. In fact, for me, it makes me feel too full. It's too much, too many vegetables and fiber. It's hard to eat that much. But anyway, it's good. It's a good place to start for sure. Right. The other thing I was going to mention, talking about inflammation, that's sort of the underlying thing that we think underlies cardiovascular disease, right? So again, getting back to just heart stuff for maybe the last 15 minutes, we're winding up Heart Month. This is when we've been educating people on heart disease and its impact. Heart disease is the #1 killer of men and women. Most women don't realize that, but heart disease is the #1 killer of women. Heart disease kills more women than all cancers combined. So we need to know those statistics and pay attention to that, because again, it can help us make better changes, right? And better decisions for our health. So if we know, you probably know that cholesterol causes plaque that can lead to blockage, that causes heart attacks, but there's something that happens before the plaque, right? So why does plaque develop in some people and not others? Why do some people have heart attacks and not others? What starts the plaque from developing in the artery? And they think that it's inflammation. So that's the underlying sort of initiating factor, that we have this inflammatory response in our body, and it creates these areas in our arteries where plaque is more likely to be able to stick, so to speak, to that area in our artery. So again, it gets back to inflammation. We think of inflammation, again, evolutionarily, inflammation is good, right? So if we cut our arm, the body has an inflammatory response. All the immune cells rush to that area, and we get this red area, and we get some swelling and a little puffiness, and that's all our inflammatory response. So that inflammatory response helps us heal wounds, right? So, but what happens when that inflammatory response is throughout the body all the time? It causes things like cardiovascular disease, autoimmune diseases like lupus, again, certain other diseases. So it's the underlying factor is this inflammatory response in the body. So like that, the fire, the body's on fire, right? And so how do we what do we do for that inflammation? Well, again, it goes back to these lifestyle things that I was talking about. So a lot of inflammation comes from the gut, right? So it's things we put in our mouth that go to our gut that cause this inflammatory cascade. So the most inflammatory foods we can eat are meat and processed foods. So again, if we cut back on those type of foods, when we eat, if you get my newsletter, I had an article this week in it about TMAO. So we eat a piece of meat, and it goes into our gut, and the body breaks it down, and some of these chemicals that are released, if we're not following a healthy diet, we don't have a good gut lining, right? So you've heard of leaky gut, maybe. That's what leaky gut is. The lining of our gut has been degraded by crappy food, and then some of this, the toxins basically from the bacteria in the food go through the gut and can affect our mental health, right? There's the gut-brain axis where things in our gut affect our brain. There's the gut-heart axis. So some of these chemicals have adverse effects on the arteries. So again, it's thought that this inflammation is what starts the process of this cholesterol plaque developing. So anti-inflammatory things in the body. So that's things like a whole food plant-based diet decreases inflammation in the body. Stress management increases, self-care, all these things we talked about decreases inflammation in the body. Exercise is a great way to decrease inflammation in the body. So all those 6 pillars of lifestyle medicine that I talked about, alcohol is an inflammatory substance, increases the inflammatory response in the body. So if you follow those pillars of lifestyle medicine, you're affecting lots of things. So you're cutting down inflammation, you're losing weight, you're sleeping better, so your mental health is better. You're cleansing the brain of toxins, so you're aging with less dementia. So again, it's all related, and it all goes back to these lifestyle things. So again, that should empower us, right? Because we do have a lot of control over it. And again, one thing, it's not like you have to do certain lifestyle things for your heart and certain lifestyle things for your your brain and certain for your kidneys. It's all related. So whatever, all these things that we talked about, they're good for all of it. And so they're good for everything. So that's good. So if you have any other questions, type them in the chat. We have about 10 minutes left. So I'll try to think of some other things. You know, I get the question a lot of times, when should people start worrying about their heart health? You know, it's never too early, right? It's never too early to start. And so, and, you know, change can be difficult, but, you know, once we make changes to a healthier habit, it takes a couple of months, but then that becomes routine and part of our life, and we don't even think about it, right? So there's a question, are seeds good or bad for the stomach lining? So seeds are good anti-inflammatory, antioxidants. Seeds are good for us. Some people if they have diverticulosis or diverticulitis, seeds can irritate their gut, but in general, seeds are good for us. So unless you had some specific reason you couldn't eat seeds, then yes, they're good for you. The other thing I would say is that, you know, everybody should know their numbers, right? So you should know your blood pressure. You should know what your blood pressure normally runs. You know, a lot of times people go see the doctor and their blood pressure can be high, and people say, oh, well, it's just I'm nervous because I'm at the doctor's office. And that can be, but it also could be that your blood pressure is high all the rest of the time too, right? Because if you don't check, you don't know. So think of it like, you know, it's one of your vital signs, and you should check it. So these days you can buy good blood pressure cuffs on Amazon or, you know, at Target or Walmart or your local pharmacy. And you buy the upper arm blood pressure cuff. Don't buy the wrist one. They're not as reliable. So an upper arm blood pressure cuff, and you push a button, you know, you sit there, you elevate your arm and let it rest on the table for a few minutes. Your feet are flat on the floor, and don't have to make sure you go to the bathroom before you sit down, because having to urinate makes your blood pressure go up. So sit there, you relax for a couple of minutes, and then you blow the blood pressure cuff up, and it does an automatic reading. And you can take 3 readings and get the average, right? Because our blood pressure constantly fluctuates, it constantly changes. So you just average your readings. So you check your blood pressure. You know, I tell people check it a couple times a week. So just so you know what your normal blood pressure is. Normal blood pressure should be 120/80 or less. So if your blood pressure is running 140/90 consistently, you know, not one day, but on average, if your blood pressure is 140/90, that's too high. We know that people who have elevated blood pressure over their life have increased risks of heart attacks and strokes and heart failure. So again, you want to try to manage it with these lifestyle factors. If you see your blood pressure's running 140/90 and you're feeling okay, that's not good, but maybe first you try these lifestyle things we've talked about. You clean up your diet, you start walking every day. Weight loss is associated with blood pressure going down. For every pound you lose, your blood pressure goes down. So you try those lifestyle factors, but sometimes people, no matter, they may be following all those healthy lifestyle things and their blood pressure is still too high. Well, then you may need some medicine. But going back to the key is know your numbers, know what your blood pressure is, and know what your cholesterol is. So, you know, the guidelines recommend that everybody have their blood pressure or their cholesterol checked, you know, in their 20s, and then maybe every 4 or 5 years, but then as you get older, it needs to be more often, right? Because things change. You know, women, our cholesterol goes up after menopause. Maybe your diet's changed, so your numbers aren't as good. So know your cholesterol numbers. It's also a new guideline is that everyone have LP little a checked at least once in their lifetime. So that may change to more often, but as it stands now, you should have your LP little a checked. So you may not have heard of that. That's a type of cholesterol molecule that is more atherogenic. So it causes more heart disease. So we know that people may have an okay cholesterol number, their total cholesterol and even their LDL may be okay, but their LP little a, this very atherogenic particle, is high. And those people need even more aggressive risk factor modification because they're more likely to develop cholesterol and atherosclerosis plaques. So that's a newer number that you should be aware of. There are some other newer particles that we're learning more about. ApoB is one that, again, it's not routinely checked, but it probably should be checked. So you can see, again, that's a more atherogenic particle. So if you have these more atherogenic particles, again, you're going to ramp up your diet. And you're going to follow it closer. You may get some screening tests. You know, in my clinic, I offer carotid intimal thickness, which is an ultrasound of the arteries in your neck. And that looks for plaque because we know that people that have plaque and thickness in the arteries in your neck have increased blockage in the heart arteries. So it's related. That's the other thing to remember, that there is no routine cardiovascular screening other than lipid panel that's recommended. So, you know how we get mammograms to screen for breast cancer and we do colorectal screening. We have screening tools for cardiovascular disease, carotid intimal thickness, and CT calcium score. You may have heard of those. Insurance doesn't pay for any of those. Because insurance, for whatever reason, doesn't pay for any screening cardiovascular tests other than a standard lipid panel. So yeah, a standard lipid panel won't check a little LP little a or ApoB. So that and your insurance may not pay for it too, is the other part of it. But yes, it's recommended that everyone have LP little a checked at least once, and you'll probably have to request that. Especially, you know, it's a newer thing, so your primary care doctor may not have heard about it, right, or be up on it as much. So it's something to be aware of and pay attention to. You'll probably be seeing more articles even in the lay press. And again, I write about things like that in my newsletter. If you want to reach out to me, and I'll put you on my subscription list for my newsletter. Again, you can go to my website. It's www.hearthealth.care. So I have, you know, I see patients, depending on where you live. I can be your cardiologist, or I do coaching. I have a health coach that works with me. I have online courses you can take. I have a 12-week course where I teach the foundations of health. So some of these things we've been talking about, that incorporates health coaching with that. I have a 52-week online course where we meet once a week and talk about all things health related. And I send out videos and audios of different things. And it's like this community of people interested in health, and so that's a great thing to join. I have some free resources on my website. I have a quiz that helps you assess your risk of heart attack. I have some downloads that you can download. I have recipes. I put some heart healthy recipes on there. I have a podcast that I do once a week where I talk about different health-related topics. So you can find all the links to all that stuff on my website, and or you can reach out to me at Dr. Tracy at hearthealth.care. So I have a lot of resources to help people. So we're coming up on the end of our hour. I hope that you learned something today and maybe share some knowledge with someone in your life so we can stamp out heart disease together and help people live longer lives in good health. So let me know if you need something or if you have any questions. If you think about something later, you can always email me and I'll get back with you. All right, and I'll see you next time. Thanks.